Good afternoon, everyone. Thank you for attending the March 26, 2014 webinar on creating a culture of health for municipal employees. If you cannot hear us, please type it in the question bar and we will make those changes appropriately. We have about 20 people registered for this training. The elected officials who are registered will receive 1 university training credit. Today's presentation is available on our website at www.cml.org. Under the Resources tab, then Training Materials. The webinar, if everything works out, will be recorded and posted on the website this week under the Training Materials also. For those of you who haven't accessed the webinar, you should see a control panel to the top right hand of the screen. You have an orange arrow to the left of the panel which will minimize the entire box. All participants will be muted for the webinar but are encouraged to ask questions by typing them into the question box on the control panel. Questions will be answered at the end of the presentation. I'll turn it over to Tanya Dillard, Health Promotion Manager for the Cigna Mountain States region. Thanks, Tanya.
Hi, thanks, Dia. Again, I'm Tanya Dillard, Health Promotion Manager for Cigna's Mountain States. And basically what that means is I am a wellness consultant going out and consulting on how to set up wellness programs for Cigna clients between 250 employees to 5,000 employees. So just a little history about myself. I've actually been doing wellness for over 15 years, which is hard for me to believe. I got my start basically working in public sector as a health educator and then moved on to become a telephonic health coach and then went on to become a coordinator in a large hospital system and then have been in strategy consulting for about the last 7 years and doing that with a variety of organizations, many of which are and have been municipalities. Most recently, you may recognize my name from presenting at ICMA last September in Boston with City of Lakewood, who is a client that I work with, and we presented on their path. And what they've been able to accomplish and achieve and what they have going forward that we're working on. So it's been really exciting. I really do like working in this capacity for Cigna. So I am going to jump in. I will apologize on the front end to say haven't used Windows 8 today or yet, and so today is a new experience, so I will try to make this as easy as possible. One thing that I did notice is that it does bring up my PowerPoint slides all at once, so I'm going to have to just try to guide you to the points that I'm talking about currently and just ignore the rest of the points in the slide until we get there. But before we jump into the actual PowerPoint, I am going to have you sit back and just reflect for a moment about why wellness matters. And we do a lot of work trying to get senior leaders on board with wellness programs because sometimes it takes some time for them to believe that it matters. And one of the ways that we go about getting that buy-in is to talk about, well, okay, what is the benefit of instituting a wellness program? And what we really believe is that organizations really want to give their workforce and their organization an edge. And that really brings us to, whoops, the next slide. Like I said, I'll try to make this as painless as possible. There we go. And so I want you to think about, how the point of wellness programs is really to bring about an edge for your organization. So municipalities are really pressed with shrinking budgets, lots of financial pressure, so almost like a fixed income in a lot of ways. And so trying to do more with less and still trying to give the highest level of service to their communities with less resources in which to do it. So how do we do that? Part of it is really getting everyone to work at their best potential, and it's hard to do that when you aren't feeling well. So that's a great concept, but how do we definitely flesh that out in more concrete terms? We asked a number of our other organizations that we work with, how do you define what that edge is in context to health and wellness? And they came up with the 5 tenets you see in front of you, and that's a healthier workforce, lower benefit cost. It would be nice to be able to offer sustainable plans year over year. We know if healthier people are on the plan, it's easier to do that. Some groups felt that better employee retention was really, really important. I work a lot with oil and gas, and that is incredibly important to that industry. Obviously, fewer sick days. This helps be able to stay at full power in having people work at their full potential every day is incredibly important, and that gets really to the higher productivity. So if we look at these 5 tenets in the context of health and wellness, this is what most organizations would say defines giving them the edge. But let's look at it in context of the nuances specific to municipalities. Oops. So if we think about it, the entire country is dealing with poor health outcomes. We know that 66% of the population is overweight, and when you consider that 66%, about a third of that is actually in the obese category. And when you consider that for every obese person that we have on the plan, it's an increased about $1,400 per year to cover their health and welfare costs. So if you think about that, if you have an organization of 1,000 people and about a third of them are in the obese category at $1,400 per person at $300, that's quite a lot of money, quite a big line item. So if we could wrap our arms around the obesity risk and mitigate that, we actually would be able to potentially not only just have better productivity, but potentially be able to do more with that money in other places. You can also see some of the other obstacles facing getting that edge. This is gaps in care. So this is our folks who, maybe it's the 40-year-old who has not got their mammogram, or perhaps the diabetic who hasn't had their hemoglobin A1C checked recently. We know that 55% of Americans have some sort of gap in care that really should be addressed. We know that 50% of Americans are not exercising. I find that interesting that also about 50% of Americans also have a chronic condition. So I'll let you make the correlation there. We also know that about a third of Americans have metabolic syndrome, and if you don't know what that is, basically that is a precursor for diabetes. There are 5 risk factors, and these range from waist circumference to LDL. There's several others. But if you have 3 of these 5 risk factors, it is very likely that you will develop diabetes later in life. We know that a third of the population already has metabolic syndrome. So to the extent that we can go ahead and wrap our hands around that, mitigate that risk, again, we are not leaving funds on the table to deal with that particular issue. We know that 20% are taking a medication for mental health, and 20% still use tobacco. It actually is a little bit lower since these statistics came out. It's actually about 18% nationally. But how is that even more specific for municipalities? You can see on the slide ahead that given everything that we know that's affecting the rest of the general population in the United States, that there's actually a couple other nuances specific to municipalities that make this even more troubling, if you'll forgive the adjective. But the average age and disease burden in government is actually higher. So the average age in government is about 42.5 years, which is about 7 years older than other industries. And the rate of chronic disease amongst municipalities is about 10% higher. And you can see below in line where I'm circling my cursor right here, that hypertension, cholesterol, and diabetes really are at the top. So this is where most of the groups that I work with at our municipalities, we are focusing our work in the context of budget pressures, low health engagement, and the task of actually administering incentives at the municipality level, which I will pause here and say there are some specific nuances in incentive administration that have, and historically, I would say, prevented being able to get great engagement in programs that might mitigate these. But we're finding ways as we work with government entities to be able to more effectively work through that. So where do we start? We have all these concerns. What do we do about it? The first thing to do, of course, is lay the foundation. So I'm going to try to keep your attention up here on this first part. Don't worry about the next. We'll get there when we get there. But getting the support from your senior leaders is going to be critical to get a unilateral incentive administered across the population, to get data that is accurate across the population. But when you go to get that support from your key stakeholders, you have to have a conversation that's going to resonate with them in a way that's salient to their area of responsibility. I mean, most groups and leaders will say, yes, wellness is the right thing to do, get it, but specifically, how do I lend support, and what's in it for my part of the organization? So gaining support from them in talking in terms that matter, such as, a lot of times healthcare costs are going to matter to the director of benefits. Turnover, disability claims might matter to other parts of the organization. Morale may matter to other parts of the organization as well. So talk in terms that matter to that particular key stakeholder. It will always also work out better if you have data. Data works especially well when you're looking at healthcare costs, and we know that those tend to go up year over year. But if there's a way that you can dive into the data and look at, all right, how much of this is attributed to lifestyle? What you're going to find really is about 70% of disease and disability is a result of lifestyle factors. So to the extent that you can pull the data out and look at it in those terms and then present that back to your leadership, it will probably spur them to think about, all right, if it's lifestyle, what can we do to contribute to people living and changing into a healthy lifestyle? So the next piece is looking at their core beliefs. So the core beliefs with leadership is critical. This will help you understand where they're driving the organization, what habits, attitudes, values are driving their leadership in the organization. We actually have tools that I work with and utilize in conversations with senior leadership to understand what are the core values of the organization. And I'll show those and share those with you in a few more slides. But understanding that through an assessment tool can really help to align expectations for what leadership wants overall from the wellness program in years 1, years 2, and years 3, and further on down the line. What we find is that if we don't have core beliefs conversations, it's difficult to align expectations with current program. So it'll make a little bit more sense when I pull up this slide. Additionally, I would recommend setting up or conducting a needs assessment. And so this would really go out in some ways to the employee population through an interest survey, but also looking at, again, the data from healthcare claims. If you actually have information from a health assessment that's been taken, that's great as well. Biometric data is also extremely helpful, because then you can start to say, all right, this is where our risks lie. Is it similar to the other municipalities? Is it diabetes, hypertension, high cholesterol, or is it somewhere else? The more that you can dig into that data and understand the needs, the more successful your program will be. This will also help you understand where the opportunities lie, but also what is already working well today. Finally, go ahead and get a wellness committee established. The wellness committee should be right-sized for the organization. I've worked with organizations before where they're really too large, and really to get them to make a decision will kind of turn into Titanic. So you want to right-size it to your organization, and that will vary depending on how geographically dispersed you are and how large you are. But that said, you do want to recruit from all areas within the organization with varying skill sets. We don't want an entire group of triathletes running the wellness committee. What we do want is people from all walks of life, all fitness and health levels, and representing different parts of the organization. I will make some recommendations. It's always great to have some of your leadership, of course, involved in the wellness committee, but also someone from your communications department, so that they can see opportunities where they can partner with you to communicate well to the organization. All right. So the next is part of what I use during a core beliefs discussion, and this is really where we'll start in talking about, all right, if you're interested in wellness, here's a continuum of wellness programs year over year, and you can decide what feels right for you, and then we can align expectations to where you are on the continuum. Typically what we see are groups want data first. And so they'll go into their wellness program thinking they want to focus on health awareness. That's the year one. And really, I almost want to say this is not just year one, possibly stage one, particularly with public entities. The health awareness phase may take a year to 3 years, where primarily you're gathering data via health assessment and biometric screening, and then doing activities throughout the year to improve health, improve excitement about the program, and build morale. So this is typically where we see groups start. Oftentimes, groups will also stay here for a while, but then the question sometimes becomes, what are we getting with the wellness program for our investment in these health activities, such as the health assessment and biometric screening? And this is where it's really important to align expectations with those leaders. Health awareness is kind of the crawl before you walk, before you run. There's not a ton of what we would call return on investment here, because it's really about building awareness. As you start to move through this continuum, we start to see greater value of the wellness program and potential return on investment. Well, what you'll notice as you move through this continuum from the purple, let's say, to the blue, you go beyond just understanding health status from the health assessment and biometrics to where now it's not enough just to do the health assessment and the biometric screening, but you have to do something that demonstrates you're improving your health. This would be working with a coach, participation in coaching programs, whether they be online or on-site. So it doesn't necessarily mandate an outcome, but what it does say is, great that you understand your health status, but now we would just want to know that you're doing something to improve it or maintain it, depending on what your health status is. As we move over to the orange side of the continuum, you see this is an outcomes base, where folks are actually having to achieve a biometric of, say, BMI less than 30, perhaps it's cholesterol less than 200. We would consider this pretty progressive, but groups are certainly moving to it. There's been actually a large wave of groups that put it on their roadmap to get there over 3 to 5 years. And the reason that is because it is associated with greater value of investment and return on investment. And so groups have progressed from health awareness through health improvement to the outcomes base, and it usually takes, you can do it in 3 years, but it usually takes several years to get there. But that's on the roadmap because it does deliver the greatest value. So once we have discussed this continuum with senior leaders and align their expectations to wherever they are across this continuum, we like to do a little deeper dive. And that's going to be what I'm going to show you next, is our actual core beliefs tool. So great that you want to do health awareness. What are you willing to leverage to get there? And so that gets down to what are you willing I guess, what buttons are you willing to push to make this wellness program come to life? So if we're in health awareness and we want to launch a health assessment and biometrics campaign, what role do you believe that you should play in making that happen? Do you strongly believe today that you are just there to help administer benefits? In which case, maybe the health awareness campaign will not have a ton of participants. However, if you're looking to influence personal behaviors and affect health outcomes here on the right side, you're probably more likely to communicate and put an incentive that is right-sized for your organization on that health awareness campaign and get more traction. So it's really important for us to kind of step back and say, okay, we know where you want to be in a year with your health awareness-based campaign. What do you feel like your role is in being able to influence that? And so oftentimes I'll go out with this particular slide here and say, all right, today, do you strongly believe on the left side, the purple side, with regard to employer role, incentives, network, future cost management, what the role of the carrier is in funding? So we may find that groups are over here, and that's okay for right now, but potentially the vision might be more along the 3 or 4, or maybe even the 5 and 6, where the employer or the municipality believes that they do have the ability and the right to influence personal health behaviors and outcomes. They feel that they can impact health improvement. They can slow spending through consumer-based platforms. So just depending on what the strategy is long-term, this can be a very, very powerful tool to be able to understand the map to making that strategy work for them. So once we understand the core beliefs and what an organization is willing to leverage to get started and affect that health improvement strategy, moving along that continuum we've already discussed, we want to set up a plan. The first thing you would want to do is, in developing your operating plan, set measurable goals and objectives. And these should always be based, again, back on the data, or maybe it's the lack of data that you do or don't have. So perhaps a measurable goal is to get credible data via the health assessment campaign, whereas there may not have been any previously. Or perhaps it's with the biometrics, or setting measurable goals to affect a particular claims experience. So either way, depending on the data that you've already gathered, you want to set measurable goals and objectives. In addition, you want to include an implementation plan. It's one of those old adages, you get what you plan for. So if you didn't plan for somebody to take on the communication piece, if you didn't pilot activities and have an owner for that, then you probably won't get a ton back from it. So be detailed about how you actually go through your implementation strategy. In addition, because of, and I find this to be common with many organizations, not just municipalities, but because of the limited amount of dollars available, you do want to think about how do we maximize our resources to affect the broadest group of people possible. In addition, some groups have gone to the extent of thinking, okay, how do we even allocate dollars to really, really focus on the people who need help the most? So ideally you have a strategy that is mindful of both of those, but really maximize the resources the best way possible. And then it's pretty straightforward from there. Get the participation. So we really would suggest getting the active and public support of your managers. And a really good example of this was what City of Houston did to kick off, I should say, their biometric and health assessment campaign. They were very, very public with one of their leaders actually taking the bus in and going and getting their biometric screening done, and actually it made the newspaper. But because of that demonstration from senior leadership, we feel that it had a really significant impact on getting many of the rank and file to actually participate as well. Always works really well when you also have a incentive, and if you can tie that to benefit plan, it tends to be viewed as more substantial. So for example, you could offer a $100 gift card for showing up and getting your biometrics done. What we find is that they will get marginal participation, potentially anywhere from 30 to 50% of the population. However, once you tie it to benefit plan design, and it may be just that you get $100 into your HRA or HSA, we actually start to see about 70 to 80% participation in activities. So that's what it means to use incentives strategically. And you have to think also what is within the culture that you have today when you're setting up these incentives. It may not be something that you start off with, linking incentives to your plan design. However, over time, it may be something that you want to move to only because it does garner more participation. Finally, using multiple communication methods, repeating the message often. So you may or may not know this, but it takes at least 7 or 8 times of communicating a message before people really even take notice, and upwards of that before people actually take action. So keeping the messages clean and consistent and clear and repeating them often will pay off. All right, so building a culture. So we I think as an American society struggle a little bit with this, and I would tell you that groups who really do embrace the culture do have more success with their wellness programs. And what does that mean to build the culture? It means that building in reinforcement throughout the organization that health is the obvious and easy choice is the norm. So this means leadership sets the tone that they value people taking care of their health, and they proclaim that it's a very important value for the organization. They also have accountability for facilitating a healthy work setting, and those who actually follow through in their areas of responsibility should be rewarded for their success. In addition, policy support is a great way to set the tone for a healthy culture, and this means looking at policies around vending. So do we bring in donuts every Friday, or do we bring in fresh fruit every Friday? Do we allow people flex time to go and work out and then come back and finish their work? And then also tobacco policies. Are we an organization that finds it so difficult to reinforce or enforce a tobacco policy that we just throw our hands up altogether, or do we at least make the proclamation that we know tobacco has no value for anybody to use, in that we want to hold people accountable for not using it and reward them. So those are some of the examples of how you can roll in some policy support, and that really does reinforce a healthy culture. And then additionally, you want to create opportunities for health improvement. So it's not enough just to give the awareness and an incentive, but you really want to give the opportunity for your employees to build skills. So things such as exercise challenges, attending health fairs, going to Weight Watchers at work, things where they have the opportunity to apply what they learn in seminars or with a coach to affect their biometric screening numbers. Those will be really important. So think of it in terms of how do we give people education, but then what do they do with it? Are we giving them the opportunity to apply it? So think of it in terms of that. And that, of course, helps to set the tone for a healthy culture. Finally, want to bring in evaluation. So again, when you pull in the metrics, you want to think about measuring against that baseline. So are you doing the health assessment year over year, and is it a statistically significant sample? If it's not, then it might be time to think about how do we incent people to get there so that we really have a good understanding of our health status. Once you have that really good understanding and baseline, it's easy to do it again and then measure health improvement or lack thereof year over year. You can also assess gaps in care. This is typically something that we would see in reporting from a health carrier, and obviously biometric reporting as well. Also, you would look at participation numbers. So if you're going to take the time to offer Weight Watchers at work or education seminars, it's important that you're tracking those numbers. That is a measure of success. This also gives you the opportunity to reflect, take a step back, and look at what worked well and what did not. So from an implementation standpoint, from a programmatic standpoint, what seemed to garner great participation and what could be improved? Where are the areas of opportunity? Every good program should have the space to be able to look at areas of opportunity and growth. And that kind of brings me to my next point is how do you reach the same amount of people or more with the same resources year over year, or possibly even less resources as budget constraints seem to become tighter and tighter. So as you think about what you have worked on year over year, one year may be blood pressure focused, the next year it might be weight, but you do want to have, an evolution so that the program remains fresh and engaging. So I just want to take a moment just to say that we have been working successfully with municipalities for several decades, I believe now, in an effort to affect what we can affect in terms of health promotion. Cigna has been working and diligently to try to address the unique needs with the budget pressures. We all know that healthcare costs continue to go up and that engagement remains an issue. But we do find that we are making some strides. And again, I would point to some of the groups that I've worked with in the past, City of Lakewood being one of them. But we do have great partnerships and are able to work through some of the unique challenges with the municipalities to affect health improvement. It's not necessarily an easy task, but we are moving down that path. So I would invite you to, one, ask questions, because I'm going to turn it over to ask those questions at this point, but also reach directly out to me if need be or desired, and we can start to talk about, all right, what is the right path in the constructs of your organization. So right now I'm going to open up the floor for questions. And what I'm going to do is actually let you, if I can open up this box, type in your questions into the question box, and then what I will do is read the question and then provide my answer as well.
Okay, there's one on there, just a personalized one, so don't read it. You can pull it out on the top, click on the top toolbar. And it says from Kathleen Harrison. That's the one that you don't read because it's just a personal one. On the first one, you don't have to read that one. Okay. So it's just, we would just confirm if somebody signed it.
Would you suggest for an organization of 4 employees? Okay, I have my first question. So, I have the question of what would I suggest for an organization of 4 employees? So my guess is So 4 employees is pretty small, and you're not going to be able to get a ton of aggregate reporting like we would in the segment that I typically work in. But for 4 employees, there are so many good community-based things that you can engage in. 4 employees is almost in and of itself a team. So there's lots of cool team things that you can do. You can challenge one another 2 against 2 or individually. I would even say there's really great technology today, Fitbit, Jawbone, any of those, and you guys can all compete against one another and connect online if in fact that was of interest. So within a small organization like that, there's actually a great bit of latitude because you're not trying to turn the Titanic. So I would say things that are fairly individualized would help a great deal. I have another question. How do you bridge the gap between activities tailored to fit individuals versus individuals just starting out? So I think that gets back to setting up a program or a wellness program that has multiple levels of engagement. So you have your fit individuals who should be rewarded basically for maintaining their lifestyle, and so there should be some things within the program that rewards them for doing that versus somebody who's just starting out. So we call this really total population health improvement. For example, you can set up, and there's lots of organizations who can do this, but you could set up an incentive strategy where it's based on points, for example. And if you achieve so many points, then you get a particular incentive. And then those points can be attributed or they can correspond with different levels, something that would appeal to the fit individual, something that would appeal to somebody just starting out. So obviously you're not going to incent everybody to complete a marathon. Your marathoners will be really excited, but the people that basically are just starting to walk, that's not really going to work for them. So I would say you will have to have several different levels within a program to be able to adequately incent and inspire. Okay, and if I haven't answered your question, continue to prod me because I can continue to go through something more specific if you'd like. What would I suggest for a rural wellness fair or wellness check day for small groups? So let me go with the rural wellness fair, and I can tell you, so see what you can leverage already in your carrier. They may have some resources that they can bring out to your site. Now, if it's so rural that it's outside what they would call an MSA, then what I would do is look to see who are your local partners. And oftentimes it's a win-win with your local partners to be able to come out and help with the wellness fair. So that's where I would recommend starting. And then a wellness check day for small groups. Again, I would see what you have through your carrier, and a lot of carriers today are offering wellness support. So I would see what can you leverage through your carrier. And then if there's nothing through the carrier, then again, starting to partner with local entities can be really, really helpful. So this could be, American Heart Association, local healthcare providers. So sometimes hospitals actually have an arm dedicated to community outreach. Now, I'm curious to know on the wellness check day if you're also asking for how you would structure it or the content of that wellness check day. If that's also among the question, you can go ahead and type that in. If not, then, and we've answered the question, then I'll move on. Let's see. Oh, yep. So it looks like yes. So how would you set up the wellness check day for a small group? So keeping in mind how diverse you might be for that small group. So I don't know if this is onesies, twosies all over the place, or if this is a critical mass in one place. Ideally, you would want to get all of your in-force employees that you can to come to one location, but just depending, it may not make that much sense. Now, what you can have for a wellness check day, oftentimes we do see biometric screenings. We also see dermascan, so some groups will actually have a dermascan, particularly when you consider that you may have a lot of employees who actually work outside. So having that dermascan for cancer screening is really important. You'll also tend to have folks from the carrier, believe it or not, come just so that people, if they have questions about their coverage, it's a nicety to be able to bend somebody's ear at that point in time. We usually see other vendors come in, so health improvement and vendors. Sometimes you can actually have somebody from Weight Watchers come in, and that will start to, I would say, spark some interest on whether or not it makes sense to actually bring them on site. So those are some of the things that we definitely tend to see. Sometimes you can get mobile mammography to come out and actually participate in a wellness check day as well. Generally, that's about it. That's typically what we see. But when you start to factor in that you can bring in local vendors, it could run the gamut. So just keeping that in mind. All right. I'm getting all kinds of questions. This is great. Okay. And I apologize. They're just kind of starting to come in. All right. I got a long one. If an employer provides a monetary incentive to employees for participating in biometrics plus meeting certain goals results, how much are you seeing companies offer? Good question. We currently provide $100 for participation and up to $500 for meeting certain goals, all of which are deposited into an HRA and HSA account. What are your thoughts about allowing the employee to apply the incentive toward their premium versus having incentive credited into their account? Okay. So I have to commend whoever this person is. Actually, I can see who it is, but I won't read the name. This is actually a very progressive program. And what we find is that this is the strongest, most progressive program that would get the most participation. So I'm curious to know if you're doing this and how much participation you're getting. That said, we are big proponents of consumerism because it really does facilitate people taking more ownership of their health care and becoming really skilled consumers and advocates for their own health care. So what we like to see is exactly what you have detailed out of depositing into an HRA and HSA. To the extent that you can get it to an HSA and really have your employees understand the benefit that this is tax-deferred savings is really, really powerful. That being said, we see it as a progression. Not all groups are ready for that, and some groups it's going to take a lot longer than others. Now, what we do see in terms of dollar amount, usually $100 is probably the highest we would see for health assessment and biometrics. We actually see groups moving towards making that what we call a gatekeeper. A gatekeeper meaning you have to do these two things first, health assessment and biometrics, and you'll get a low dollar amount like $25 before you can actually get the big money, $300, $400, $500 for meeting certain participation or even outcome goals. So that's where we're seeing groups start to move because they do realize that giving a big incentive on the health assessment or biometrics, it's not enough to actually inspire health improvement. And so they really want to put the dollars, the bulk of the dollars, sort of how you've already detailed out, on health improvements. So that's participation again, meeting certain goals, perhaps its outcomes. What I will tell you, oftentimes we see groups start off with $100 if you do biometrics and health assessment, and they do it with like a gift card or some sort of raffle or drawing. And then over time they phase that out. They bring that monetary amount down, and the mechanism for that reward changes to HRA or HSA or premium credit. Now, the difference between, answer the second question, how effective do we see differences between premium credit, HRA, and HSA contribution? Mixed results. I will tell you we get a lot of interest in folks wanting to affect their premium. When you tie biometrics health assessment or any other behavior that's wellness derived towards the premium, we start to see upwards of 80, 90, even 95% participation in the wellness programs at that point. Similarly, we see it in the HRA or HSA, but it has to be a compelling enough amount into that HRA or HSA. That compelling amount is going to start around $200 for things like participation or outcomes. So that was a really long-winded answer. I hope that I gave you a lot of detail. If you have something more specific, go ahead and type it in the chat box. Let's see. So I've got some more, I think. Bridging the gap. Somebody had asked, can we please get a copy of the presentation, or how do we print out a copy? Dia, I'm going to let you take that one.
That is posted on our website at the moment under the resource tab, then training materials, and it should be the first one on the top.
All right, so the floor is still open for other questions or clarifying questions. So I'm rereading your question about my thoughts on allowing an employee to determine whether or not they would want to apply the incentive towards their premium versus having an incentive credited into their account. If you have the ability to toggle between that flexibility and offer that to an employee, that would be extremely powerful. It becomes a much more salient and meaningful way to incent when somebody has the power to decide how they want to receive their incentive. So if you have that ability and can offer that up, I think that's a big stride forward.
My question on that, are you able to add more things into your HRA other than what you're already approved for? Because I know that they audit you on that, can they? Or you have to can only post so many things in there?
Yeah, so there's a limit to the dollars too.
Oh yeah, that's what I was thinking.
Have any more? Okay, well, it doesn't appear that I have any more questions coming in. If in fact you have oh, excuse me?
Have one more question?
Yep. Oh, well, got one more, sorry. Are you seeing employers providing wellness benefits to spouses? Maybe not an incentive, but participation in fairs, programs, etc. Yes. And so here's a very interesting tidbit. So I often sit in planning meetings, and some of that comes from review of healthcare claims. And we are able to look and see, all right, so here's the employee-derived claims, and here's the spouse and dependent-derived claims. And oftentimes we see greater claims dollars generated by spouses and dependents. So it makes a bunch of sense to go ahead and roll out your wellness program to spouses, because they're actually, in many cases, contributing to the spend even more so the employee. Plus, we know people that live together affect one another in terms of all their decision making, not just health, but in a large degree health as well. So it makes a lot of sense to start to roll this out. What we typically see is, as groups move along the continuum, so say we're in Cigna is actually a really good example. First year we did health assessment. You must do the health assessment and biometrics to get XYZ incentive. Actually, at the time it was to get insurance. You had to do it. Then we rolled that out to spouses. So not only do you have to do the health assessment and biometrics, but you also have to get your spouse to go do it as well. The next year it was, okay, so now we're going to give you an incentive for a healthy BMI and being a non-tobacco user. So you have to do your health assessment and biometrics, so does your spouse, but employee, now you also have to demonstrate that you're non-tobacco and have a healthy BMI. The second year of that, we rolled it out to the spouse. After that, we started introducing biometric outcomes, which is where we're at today. So now I have to complete my health assessment biometrics and also demonstrate that I'm a non-tobacco user and have a healthy BMI and a healthy cholesterol to get my incentives. And then in the following year, it is expected to be rolled out to spouses as well. Now, because Cigna is very geographically diverse, even though we have critical mass in a lot of places, we don't really have health fairs on site, but it is a nicety if you can afford to do it and make it easy and bring the spouse in if it makes sense. We see some groups do it. I definitely have a couple municipalities who actually have gone that road. But they definitely roll out incentives over time to the spouses just because it just makes sense in terms of what you're trying to affect. Okay, that looks like all the questions that I have. I'll wait one more minute for any more, or if you guys have a clarifying question. I tend to give very long and big answers, so it wouldn't surprise me if you need some clarity. Okay, so it's been about a minute, and so I'll go ahead and close this. I do invite you to print off the slides that we went through today. It is definitely kind of a step-by-step process for building a wellness program. Do not feel that you have to do everything all at once, is what I would also caution you against, but starting to take the right steps. This will definitely help you have the right conversations to get started and then be mindful of what to plan for going forward. So in closing, thank you, everyone.
Thank you, everyone. You have some very great questions today. And thanks, Tanya. That was a very insightful presentation. Once again, you can find that available on our website under the resources and training materials. Thank you all for joining us, and this concludes the webinar. Have a great day.
I know. I'm like,
which one?
I don't know what I'm doing.
That was good. I mean, they had some really great questions at the end.
They did.